This is Optimal Health Daily, episode 1874. What your doctor doesn't know about fatigue, and the 3 diagnoses they miss, by Dr. Amber Golshani with JillFit.com. And I'm your host and narrator, Dr. Neil Malik. Hey there, happy middle of the week Wednesday, and welcome back to Optimal Health Daily, where I simply read to you from the best health and fitness blogs for free. And then on Fridays, I answer your questions. Remember, you can send me a question by going to oldpodcast.com/ask, or just send an email directly to health@oldpodcast.com. All right, and it's the middle of the week, and like I do every Wednesday, I want to share a little bit of inspiration with you. So here we go. Quote, "Life begins at the edge of your comfort zone." Neil Donald Walsh. All right, and with that, let's get right to today's post and start optimizing your life. What your doctor doesn't know about fatigue, and the 3 diagnoses they miss, by Dr. Amber Golshani with JillFit.com. Almost every individual that identifies as female who's walked through my clinic door is carrying a stack of lab test results and will tell me that, despite her low energy and fatigue, the doctor has told her everything looks fine. Energy crashes, tiredness on waking, low libido, weight gain, difficulty concentrating, and irritability top her list of complaints. Does this sound like everything is fine? There are actually several common yet grossly underdiagnosed causes of fatigue that many doctors miss. Am I saying every doctor out there is missing something? No, but many are. And how do I know that? 1, because their patients are coming to me for help, and 2, I've been there myself. Even after I lost a bunch of weight and normalized some hormonal problems I had in my early 20s, I still didn't feel great. I'd often find myself sleepy and foggy-headed after I ate, or, God forbid, if a meal was 20 seconds late, my food werewolf would attack from the potent mixture of hunger and anger. I'd slog through my day, then get a second wind at night, stay up too late, wake up tired, and repeat the whole thing over again. And even though my numbers looked fine, I felt far from it. It took some research and experimenting with my diet, lifestyle habits, and a few key nutrients, but I was able to discover the reasons I was so tired and correct the underlying imbalances. My energy improved, my mood balanced, and my head got clear. I actually have more sustained mental and physical energy now at 37 years old than I did 10 or even 15 years ago. It's the natural tendency to look for answers in what we already know, and if we can't find the answers here where the light is best, we tend to give up. Not all answers are in easy or best lit places, but it doesn't mean we should stop looking. In an effort to shine some light on other reasons we experience fatigue, here are the 3 most common overlooked causes of fatigue. 3 commonly underdiagnosed reasons you're tired, and solutions. 1. Food intolerances. These are also called food sensitivities or hidden food allergies. Hours to days after you eat an offending food, you can develop a wide range of symptoms, anything from fatigue and lethargy to skin problems, bloating, headaches, hyperactivity, difficulty concentrating, and more. While they are a type of allergic reaction, they're different than a true food allergy most of us are familiar with, where even a small amount of the offending food can set off almost instant swelling in the mouth, lips, and throat, and be life-threatening. The offending food in this case is pretty easy to identify, but in the case of food intolerance, where reactions are not immediate or life-threatening, it's harder to identify what's causing it. Most medical doctors, or MDs, don't know about this type of allergy, nor is the testing for it very accurate. Solution. Want to know if a food intolerance is causing your fatigue? Do a food elimination challenge diet. During a food elimination food challenge experiment, you remove the most common problematic foods. For some, it could be grains, others may be dairy or soy, eggs or citrus, alcohol, sugars, and any food you eat 3 or more times a week. Do this for 3 to 4 weeks. Then you reintroduce them one by one, watching for a reaction. 2. Hypoglycemia. Hypoglycemia means blood glucose levels that are dipping below the healthy, normal range. Blood glucose is simply the concentration of sugar, or glucose, in the blood. We need just the right amount to deliver energy to our cells. When the levels go too low, we can suddenly feel tired, sleepy, dizzy, confused, shaky, and irritable. Your cells are starving. No wonder you feel tired. This low point is usually when we crave more sugar or carbs because they give us a quick fix and our blood sugars rise again. The quicker the food raises your blood sugar, the quicker and harder it will fall. I call this the roller coaster effect. Why does hypoglycemia happen? There are lots of reasons, including certain medications, including birth control pills, an overabundance of sugar and starchy refined carbs, too much caffeine, lots of stress, alcohol, especially on an empty stomach, severe caloric restriction, and rarely, certain types of pancreatic tumors and people with gastric bypass are at more risk. Solution. The fix for hypoglycemia is to figure out what's contributing to it and work on that. The best type of nutrition plan will be one that focuses on protein and vegetables at each meal to stabilize blood sugar roller coaster effects for more stable, lasting energy. And 3, hypothyroidism. Your thyroid gland controls the metabolic rate of many processes in your body. It's like the gas pedal in a car. Pushing on the pedal, the thyroid, will give the body enough gas, the thyroid hormones, to go. In people with hypothyroidism, or low functioning of the thyroid, their gland isn't getting the signal to push on the pedal, or the tank is low, and no matter how hard you push on the pedal, insufficient hormones are produced. So people are likely to feel tired and run down, have cold extremities, constipation, slow or dull thinking, difficulty losing weight, low libido, and more. It's estimated that half of the people with hypothyroidism are not diagnosed. This is no surprise because most doctors only use one blood test to determine the functioning of the gland. That's like trying to put a puzzle together with only one piece. No wonder so many people are walking around like zombies. Solution. Ask your doctor for complete testing, or find a better doctor. There are a number of other lab tests which need to be looked at alongside thyroid stimulating hormone, or TSH, so that we can put the whole puzzle together. Some of those tests include free and total T4, a type of thyroid hormone, free and total T3, another type of thyroid hormone, RT3, and autoimmune antibodies, because an autoimmune response is the most common cause of hypothyroidism in the US. In summary, if you're tired, having energy ups and downs or other issues, and you have normal lab values, maybe it's time to stop looking in the best lit places and start looking elsewhere. The 3 causes previously mentioned are some great places to start, and the best thing about the solutions are that you can start to implement them right away. There are no pills to buy and no side effects. I hope this information has helped you see some of the other reasons for a lack of energy that may have been hidden in the dark for too long, and that you find some answers to your fatigue so you can elevate your energy and live your passion. You just listened to the post titled, What Your Doctor Doesn't Know About Fatigue and the 3 Diagnoses They Miss by Dr. Amber Golshani with JillFit.com. Dr. Neil here for my commentary. I really appreciated Dr. Golshani's perspective given their experiences treating patients with unexplained fatigue. As I read Dr. Golshani's suggestions, I couldn't help but think about the underlying behavior that connects everything together. No, it's not getting enough sleep, although yes, that does need to be looked at too. Dr. Golshani mentioned the importance of an elimination diet if someone thinks that a food allergy or food intolerance is causing their fatigue. Dr. Golshani also mentioned how finding the root cause or causes of hypoglycemia is important, and knowing the symptoms of hypothyroidism. How can we possibly figure out which ones we're experiencing? Can you guess? By keeping a record. I know it's not the most enjoyable thing to do. It's very tedious. But by keeping a record of what we ate, how much we ate, and when, along with any symptoms we experienced before and after, can help us and our healthcare providers find patterns much more quickly. It's like what a detective does. They keep notes of clues to find out who or what may have caused the crime. So, think of the process as though we're Sherlock or Enola Holmes. But in this case, we're trying to be good health detectives. All right, thank you so much for being here. Thank you for listening every day. I hope you're having a wonderful week so far, and I'll see you back here tomorrow where your optimal life awaits.